Perfect. Hey everyone, I'm Lauren Fleming, founder of Hem Supportwear, and today I have Ashley Newton with us. She's a doctor of physical therapy and a certified pelvic health practitioner with a passion for treating adult pelvic floor issues and yoga-related injuries. Ashley, we are so excited to have you here with us today. Thanks for being with us.
Of course, I'm happy to be here.
I'd love to start off with you just telling us a little bit about your background and what inspired you to get into this kind of work.
Sure. So I started my career as an orthopedic physical therapist. The more I practiced, the more I realized there was this big, almost like Bermuda Triangle of functioning that no one was talking about, right? And it was the pelvis. And as an ortho PT, you know, at the time, they talked a lot about piriformis, one of the hip muscles, hip flexor, very popular, very sexy muscles, but no one was really talking about what was going on inside the pelvis. So I would have patients that would get kind of better, right? Some absolutely would, but then there were those few that they would get better a little bit, but there was always something I feel like that could have been done that was more. And these were usually people that had been pregnant. These were people that have complex trauma histories. And it got me into thinking about physical therapy more than the musculoskeletal system, but the interaction between the brain, the spine, the pelvis, the organs, and how our body adapts to our emotions as well as adapts to activities we need to do to participate in. So I was motivated to start my journey and my foray into pelvic floor physical therapy. And I did a year-long certification with evidence in motion, and I kept the train going from there. And I've been doing that ever since. Mhm.
Excellent. Thank you so much for sharing that. I always find it so cool to hear how people find, different paths that ultimately lead to the same, passionate community of people who are, interested in how all this works and being able to serve the population of people who need it. So
Mhm.
thank you. Will you tell us a little bit about what a typical day or week looks like for you?
Yeah, so I work clinically Monday through Thursday, and I see people one-on-one for an hour. So I see 8 to 9 people a day. The people I see people from the ages of 16 all the way to end of life. We all have pelvises, and at some point or another, there can be imbalances that need to be addressed, and they can surface in different ways depending on what else is going on in your life. What is your activity level? So it's my job to be able to identify where is there imbalance in somebody's body and be able to provide people with tools as well as referrals to other healthcare practitioners that can help them along that journey of finding more balance in the brain, the body, so that they can achieve their goals, move through life pain-free, and uninhibited by any type of dysfunction, again, in the nervous system as well as in the musculoskeletal system. So my typical day, when I have an evaluation, when I see someone for the first time, it's also one-on-one for an hour, and I will do a full movement screen. So that means looking at how someone walks, how someone, squats, gets up from a chair, it's task specific or performance specific things. So
Mhm.
if I have somebody who dances, like what type of dance, and I will have people demo. If I have somebody who plays a sport, we will even go outside and I will see how they move with that, just so I could do a comprehensive movement analysis and see,
Mhm.
again, where maybe things devolving or could be tweaked a little bit. I really enjoy physics, and I always tell people our body is a balance of vectors and forces throughout the body. And if something isn't working, ideally, somewhere else will compensate. Then
Mhm.
I will do an abdominal evaluation. So I will assess breathing, I will assess the movement of the tissues around the viscera, around the organs, and then I will do a pelvic floor assessment. I will either do a pelvic floor assessment rectally or vaginally. Sometimes both. It depends on what someone is presenting with and the complaints that they bring to me. And then I
Mhm.
synthesize everything at the end and give people a comprehensive plan of where we're going, how long to expect in order to facilitate these changes, so that from the get-go, their brain and their body is oriented to a realistic expectation. One
Mhm.
thing that I think our profession can get a little better at is explaining the process of strengthening, the process of relearning, as well as the somatosensory experience, the process of brain retraining,
Mhm.
so that people can have grace with themselves, because there's nothing more
Mhm.
frustrating with getting through a program. 2 months later, someone's like, I still feel like crap. And it's like,
Mhm.
okay, but we had to pass these hurdles first. So I like to set people up from the beginning, because that's going to also change their progression and how they feel about their bodies and yeah,
Yeah.
how they're, how they're moving. So,
Mhm.
mhm,
No, I love that, hearing that, because I feel like so I had pelvic organ prolapse after having my first baby, and it was
mhm,
completely like a new thing for me.
yeah,
And the knowledge aspect of all of it is so critical. Like, and I continued to have it after having my second, but I did not have the same experience. And it was because I had that awareness and knowledge of like, what does this journey look like, and what are my resources, and how long can I really expect things to take to recover and feel better, and to have
mhm,
the expectation from my provider that like, hey, just because you get your symptoms down here doesn't mean they're always going to stay that way. Like, you may have something happen that makes them spike up again, but then we can
right,
work to
right.
get them down. And so I really like that part of the conversation, because it can feel so discouraging when you're like, okay, I've got help, I'm doing all the things, and I still don't feel how I wanna feel, and that can be
Right.
really hard.
Right. And I feel, for as much as I'm very passionate about elevating health literacy and making people more
Mhm.
knowledgeable about their bodies, especially people with uh, female anatomy, just because I don't feel that we get a comprehensive education about that
Yeah.
as we move through the lifespan and hormones change. But where was I going with this? Like, I just want people to know more about their bodies, to be able to ask questions and not
Yep.
feel like they go into healthcare appointments like the deer in the headlights,
Yes.
or that they saw something on Instagram, which can be so, so, so helpful. It
Mhm.
can, but can make us feel lesser than, especially
Mhm.
when things are sped up to 2 times speed and we see these progressions of someone saying, I started in August 2024 and here I
Yeah.
am in December. And it's like, well, why am I not like that? Right.
Right.
And that
Yeah.
compare and despair just tanks our nervous system, makes us feel bad, and can be so discouraging.
Yeah.
So, yeah, I like to have that conversation from the start so people can be a little gentler with their bodies, but still
Mhm.
challenge themselves. Like
Mhm.
gentle, but work hard, right?
Yes. Yep.
Yeah.
Yeah, and that I do like that part too, because I know, like, when I've gone to some of my pelvic floor PTs appointments, like, I will leave those and I am like, that's the best, like, workout I've gotten in a long time, because, like, it's that one-on-one attention is so helpful too, to, like, how is your body aligned, and what kind of movements are you doing? And, oh, maybe you
Yeah.
don't need to move that limb so far, but if it's controlled better, then it's even more challenging. So that
Mhm.
part of it is super helpful as well.
Yes.
Yeah.
Yes. Good. Good.
Yeah. How do you explain the importance of pelvic floor health to somebody who either doesn't know anything about it or has maybe a very basic understanding?
Sure. So I think the best thing is metaphors, and to use things that we commonly encounter in day-to-day life. I equate the pelvic floor to be like a house's foundation, like the skeleton of the house, that with a very firm foundation, it's laid right when they start to erect the building, you don't have any problems down the line. If the foundation is not set, the soil is uneven, there's sinking going on, everything above is going to be affected. You can
Mhm.
also say it's like the root of a tree. If you see that a tree has leaves that are turning yellow and falling off, we don't go to the tree and go, spray, spray, you're better. We go, okay, what's going on with the soil? What's going on with the root system? What's feeding the trunk above, right? So I started to talk about it in that frame of reference. We also know that in yoga, classically, the pelvic floor is looked at as the root, right? So
Yeah.
that is Mula Bandha. It is classically the perineum, and with chakras, with yoga, it is the color red. So I like to think about that as it is the base, number one. It is the place of birth as well as the place of digestion. And then I explain the 5 S's of the pelvic floor, which would be, are you familiar with those?
I'm not.
Yeah, so support the organs above. Sphincteric, so like your mouth is a sphincter, like your eyes are a sphincter. We have pelvic floor muscles that are sphincters, so they're responsible for closure and they're responsible for opening. Then we have sump pump. It's a major area of lymphatic movement. So lymphatic movement is metabolic waste that's produced by chemical reactions just of you existing. Then we have stability, then stability, so stability of the bones. It provides stability to the sacrum, and then sexual functioning, right? So those are the 5 S's. It is a very quick and easy way to say this has a lot of functions. I believe
Mhm.
I'd have to review if it's 32 or 36, but it's, I think, 36 muscles attached to the pelvis.
Wow.
So there's a lot of stuff that
Mhm.
goes there that if the base is a little imbalanced, tension too much, not enough
Mhm.
tension, too much tension at the wrong time, timing is everything, coordination is everything, that can create dysfunction somewhere else. And dysfunction, it could be a loaded word for people. And I just say anything that affects negatively your emotional and physical participation in life.
Mhm.
It's not looked at as something bad. It's not pathoanatomical, meaning of the bones that something is wrong. It's just preventing you from living
Mhm.
your best life. So that's how I
Mhm.
start the conversation.
Yeah, I love that. Yeah, and
Yeah.
because I feel like it can feel kind of like out of touch for or out of reach for people. Like if they don't know about it. So I think when you
Yeah.
can talk about it in a way like that, that's like, oh, that makes sense to me. Or I love what you're saying about the dysfunction piece because you hear certain things and people are like, well, that's just kind of how it is, or this is just what I have to live with now. And I like the well, relative to you, like what doesn't feel right, because I think it starts to shift the conversation for people to feel more empowered to like seek help and make changes. Whereas otherwise it might be like, oh, well, that's really not something I should be kind of thinking about or working on right now.
Right. And I always
Yeah.
tell people, there might be something that's off, but maybe you don't have, we call it the brain space. Maybe there's too much going on. Like maybe there's too much going on with a new baby, maybe too much with the partner, and you need to put your energy somewhere else, but it doesn't mean that you working on that won't improve the other symptoms. It could. It
Mhm.
absolutely could. If you work on the relationship with your body, with yourself, and you stop gripping your belly less, does that make it
Mhm.
so that you can breathe better? Amazing. Then your pelvic floor is happier. So
Mhm.
I always want to look at those indirect correlates in the body, in the brain functioning, and how it affects the pelvis. It's very rare I have someone that it's like, I do a full hour of corrective exercise. I tell people I'm not a trainer. That's why I hired one. Uh, like my job is to help the body reformat patterns. And sometimes it does take the form of exercise, but often it takes the form of me doing hands-on work, changing this
Mhm.
environment to change the inputs to the nervous system. Um, so yeah, I think it's a lot more complex,
Mhm.
but very individualized, right? It
Mhm.
can be, at least, I should say.
Right. Yeah, no, I think that's a great point. Um, so I know in this, you mentioned social media and how you can kind of see various things that are good and bad, which I think also helps like accelerate the information people are getting,
Mhm.
including misconceptions or myths about pelvic health. What do you see as some of the kind of most common myths or misconceptions, or the ones that kind of get under your skin the most?
Sure. Oh, the ones that got under my skin. You know, it's it's funny. I it's more in the language rather than the actual information, right? I And I know, Kegels had their moment. She had her moment, and then everybody hated her. And it was like, okay. And now everybody's really into lymphatics, and you can and I don't even know what else. Core has gone through the term. Core has gone through
Mhm.
iterations of being in vogue and being,
Mhm.
inaccurate. Um, I would say my biggest qualm. Yeah, I don't know, because like it's hard for me to say because I think all information can be good. I think my frustration is that we get it in pieces, which is just like the nature of Instagram and TikTok.
Yeah.
And we don't necessarily know what's going on in our own body, so it becomes trial and error. And I think that, well, what I tell people is one should get at least an evaluation to know what information is applicable to them.
Mhm.
Because if we are constantly telling people, this is normal, this is not, try this, try that, don't do this, but maybe not too much, it's so confusing. And there's so
Yes.
many loose ends. And we already do a lot, like as
Mhm.
especially women,
Yep.
and I treat all genders, but especially new moms, I get very protective of, oh, the bombardment of information,
Mhm.
where I feel like we could do it a little more strategically and start the conversation earlier in life so that it's
Mhm.
not like everything everything everywhere all at once, and the feeling of being overwhelmed and being less than. Because I think there's some I follow a lot of PTs and they are putting out awesome exercises.
Mhm.
And I tell people, I teach a yoga class. It's like a hybrid yoga class. I call it the
Mhm.
bone density class. Like I just want
Mhm.
people to age gracefully, through menopause and beyond, and maintain their strength, right?
Mhm.
But what I tell them is like all exercise is recycled iterations of movement. If you
Mhm.
look at, you know, and this sounds so shady, but I've been teaching yoga a long time. I also teach something called hypopressives.
Mhm.
It's a type of technique that's an abdominal vacuum. It's amazing. You can see pose similarity in yoga and hypopressives. Compare that to kettlebells. Oh, Artemis is a deadlift, is an airplane in yoga. They are all
Mhm.
the same. There is no, so I guess this is what my pet peeve is. There is no one type of movement that's better than the other. Like, it's
Mhm.
not like Pilates is going to cure you. It's not that yoga is going to cure you. It's not that you have to do weightlifting in order to get strong. There's a
Mhm.
time for everything, and different loads into the body beget different changes. But
Mhm.
there's nothing that is an all or none situation, right? So I think it can become that,
Mhm.
like this program is going to solve everything. It's like
Mhm.
maybe, but we don't know if that's
Yeah.
where you need to be, right? So I
Mhm.
always recommend just like calling your or checking out like a PT that you trust or
Mhm.
investigating just to get more information on your body. So,
Mhm.
yeah. Mhm.
Yeah, yeah, I hear you because one of the things I've seen a lot, especially with people who are, accessing the information available to them, I think like one example that comes to mind is Kegels is a great one where it's like, oh,
Sure.
the blanket thing is do Kegels during pregnancy and post. But then it's like if your pelvic floor muscles are tense, you're only exacerbating, the challenges that you have. So I think that's a great example where
Yeah.
understanding what's going on with your body because it's complicated and like you said
Oh,
with
yeah.
30 plus muscles it's that's why there's professionals and experts in this space to help you understand
Exactly.
what's going on so I
Totally.
think yeah it's hearing that is great because I think and especially for new moms it can feel I don't know, you do learn about a lot of this a lot later. It's like a lot of times it's like you've just had a baby. You're in the throes of those, first 6 weeks and then you're like, "Oh, I have a new
Yeah.
condition or new issues and how do I address this?" And yeah, it's a lot. The mental load is a lot.
Exactly. I just, healthcare in the United States, unfortunately, I could just say that, unfortunately, because I can only speak to where I live, which is here.
Right. Yep.
Unf Unfortunately, often becomes all about survival, like survivorship, right? Like, "Oh, we
Mm-hmm.
got rid of your cancer. You're alive. Amazing. We delivered your baby and both of you are alive, and both of you are healthy enough. Like,
Mm-hmm.
you don't need to you're stable enough to go home." But then
Yeah.
we don't prioritize what it takes to thrive. And I
Mm-hmm.
don't even mean like personal responsibility. I mean from a community perspective.
Mm-hmm.
I mean from family, from friends, from healthcare practitioners in your community, that we kind of leave people to fend for their own devices when it
Yep.
comes to healing. And
Mm-hmm.
healing is different than surviving, you know? Like one could
Yeah.
have a perfect example is when you give birth and you have perineal tear. Happens,
Mm-hmm.
of course. And your body recovers from it. You go to your 6-week appointment and they say medically stable. And they're like, good luck with that. Not
Mm-hmm.
everyone, but
A
oftentimes.
lot. Yep.
Because, right. And it's like no tea, no shade. we don't doctors, physicians don't get a lot of time with patients unless it's usually concierge, right? Which you have to
Mhm.
pay out of pocket.
Right.
And we're not necessarily equipped as like the lay folks are not equipped to go in and say, I have this question, this question, this question.
Yeah,
That takes some coaching. Like,
it does.
okay, what if I try sex and it freaking sucks? Like, what do I do?
Mhm.
What about running? What about walking? What about just sleeping? Like, can I do anything for that? And what about eating? Like, do I need to eat a certain way while I'm breastfeeding? Is that going to help me?
Mhm.
Like, there's no time in those appointments. So it's why I partner a lot with holistic health practitioners, acupuncturists, massage therapists,
Mhm.
more concierge doctors. And then I educate the OB-GYNs like, hey, let's just think about a comprehensive plan. So I like
Yeah.
people to have, especially with a surgery, postpartum recovery, to have a pre-op or prepartum plan, a peripartum plan, and a postpartum plan that includes all of those different modalities to
Mhm.
optimize healing. Um, and yeah, I'm very passionate about that. I feel like we could, in this country, do better at helping people thrive.
Yeah. Yeah, and I think that that's spot on because so much of it's narrowly focused, and I think as someone going through those things, you kind of feel like, "Oh, my OBGYN is like, they kind of take care of all of this," and at our checkpoints, like, that's addressed, and I think there's
Sure.
a misconception often of, like, what are they kind of really responsible for in this wide community of people, like, all of those different specialties you mentioned that
Mhm.
can help all of those other areas thrive, and then it all comes together. So that's something I've
Yes.
experienced with friends and families. They're like, "Oh, well, I did my appointments. I went to my the recovery appointments or whatever, and I'm still having these different issues." And it's like, well, they only address one piece of this, and they have limited time to address it. And so,
Yeah.
yeah, I would love to see. I don't know what it will take, to do like the
Yeah.
kind of thing you're talking about, where you can have this much more robust, even knowledge of what those options are, because I think
Right.
that's like the first step is who can help me with these things, and then how can I build them into a plan to support me and my family, you know, beginning and after, these various things that you go through. So, yeah.
Yeah. And normalizing that there's nothing wrong with you
Mhm.
because you need help.
Yeah.
That is a big thing, where people, they feel something is wrong with them because they
Mhm.
need intervention, because they need help, when really the expectation should be set that this is a very normal, expected, and helpful part of the healing process.
Yes.
Right, because then if people feel that, they approach it like, "Oh, I have to do this." Like, "Oh,
Mhm.
something's wrong. My friend didn't have to do this. Why didn't
Yep.
she do it?" And if I hear one more person say bounce back, I'm just gonna lay on the floor. Like, I'm just gonna stop. Like, I simply cannot. I just that term, I love language, and like that term irks me in so
Yep.
many ways. I'm like, nothing is bouncing, babe. There's no bouncing. We are recovering. Okay. Like, we are
Right.
putting work in. There is no one that bounces. The body does not do that. She
Yep.
heals. He heals. Like, no, no, no. It's a
Yeah.
very bizarre rhetoric that I think honestly just puts more pressure on people to come back and participate in making money and doing their,
Right.
paid jobs. And I'm just like, stop.
Well, and
Please
it
stop.
completely ignores the transformative aspect that goes along with these things, because it's like to put you back where you were, that you're not there anymore. You were in a new place. And so, yeah, with the bouncing and the back, it's like neither of those works.
Where are we going? No,
I
we're
don't
moving
know. Yeah, very
forward.
frustrating. Exactly.
Exact.
Of course.
Things people say. And this is, it's it's language is powerful and it sets expectations, and especially when we hear it from a person of authority, whether it be a
Yes.
mom, a dad, an older sibling, a gynecologist, a PT, like what have you, anyone, that's it just again makes you feel like, oh, there's a problem with me. It's like, no,
Yeah.
no, there's not. There's not.
Yeah. Yeah. So I know, of course, that pelvic health, like it has a very individualized approach.
Mhm.
Are there kind of best practices or tips that you can share that are applicable more to a general population as far as good pelvic health
Yep.
habits?
Mhm. Yes. So good health habits for pelvic floor. No straining allowed. No straining to poop. It's not good. When you strain, you perform what's called a Valsalva maneuver. Sure, that was named after a person. And what happens is you increase the pressure so much in your body that the pelvic floor tightens. So now you're going to have a battle of gravity and muscles. So for as much pressure as you exert down, the pelvic floor is going to tense. And when it tenses and against that pressure, the body is challenged to change. Just like think about with exercise, like you're challenging the body with a load. So what can happen is you can reach failure, meaning the pelvic floor has trouble doing its job, supporting the organs above. We can have symptoms of prolapse. We can have increased vascularity, aka hemorrhoids, and adaptation due to increased pressure. It's all the body adapting to what the demands that have been placed on it,
Mhm.
even if it's maladaptive in the long run, right? The body
Mhm.
doesn't have a long-term plan. It just focuses
Mhm.
on survive, right? So, it's still gonna tense in response to that pressure if one strains. I would also say that a good pelvic health practice, and this one, two things, not hovering above the toilet. Number
Mhm.
1. And yeah, especially if you're at a concert, um, you are in the airport, and if I have people that are telling me I gotta hover, and I'm like, "Well, then we just have to be okay with that." We might leak a little bit of urine after because the pelvic floor did not get fully relaxed. There might be some urine in the urethra, and it may come out. And if you are okay with that, then I am okay with that. Like, we fight the battles. Like, we don't have to be perfect in
Right.
everything, right? Like you're at the concert, it's like 1 a.m. and that bathroom is just not.
Yep.
I get it. Like don't put the pressure on yourself, right? And then I would say, for my adolescence actually, is to know that within like the first year of getting your period, it's probably going to be tough to use tampons. So to
Mm.
believe it or not, use tampons with some lube on it because
Mm.
the pelvic floor hasn't changed enough with the change in hormones that inserting a tampon could be very painful, right?
Mhm.
And then it kind of sets us up for this pain with penetration that then
Mhm.
folds over into I've never been able to use tampons. And now I have pain with my partner. And now I go to the gynecologist and I can't stand it.
Mhm.
So let's set people up for success when they start bleeding. Have them be in a supported squat, have them reclined and try using a tampon with a little lube on it. Like
Mhm.
let's let's train the brain that this is not threatening from the
Mhm.
beginning, right?
Right. Yeah.
If we can, because I feel like there's often there's pressure, right? There's pressure when you start bleeding, you want to go in the pool and you're like, I just got to
Right.
use that tampon. But what if you just had like a little lube packet and you put that on? It'd
Mhm.
make it so much easier. Like
Mhm.
so much easier
Yeah.
for it to glide, right? So, those would be, I was just trying to hit on different things more like
Yeah.
the voiding urination, voiding defecation, and colon health. I could get into that. And then like menstruation. Yeah. So
Yeah,
those would
that's
be
great. Yeah,
the
I
easy
I
three.
love all of this, and I like that it hits, can be applicable to a really wide range of people.
Yeah.
And I love the lube on the tampon. That's something I haven't heard before, and I can see where
Mhm.
that would be super helpful.
Yeah.
And I think stuff like that, I've got two girls, so it's like, okay, keep that in mind. So that when the
Yeah.
time comes, here we go.
Mhm.
You know,
Yeah.
I
Because
think
there's gonna be
tips
a
like
lot
that
of
are
shame.
great. Yes.
Yeah. And I just
Yeah.
like I'm a biological female. I bleed every month and I was brought up that it was, shameful. I feel like proverbially we still kind of put like biological females in a cave when they
Yeah.
menstruate, right?
Yeah.
I could go on about that.
Yeah, I know. I know. I
I
know.
right. I think we need to destigmatize it. Can you still hear me?
Yes, I can.
Okay, good, good. My AirPod's trying to, exit the interview.
Reject you.
Um,
Yeah.
So yeah, those would be three of my top three, my top
Great.
three
Yeah,
medical
no,
factors.
thanks so much.
Yeah.
Um, let's see. So another thing I wanted to ask you about is,
Hmm.
can you talk a little bit about how, you've talked some about, seeing people early adolescence, pregnant,
Yeah.
postpartum, and, kind of menopause. Will you just touch on, I know it's a lot, a big ask,
That's
but
okay.
like kind of high level how, if someone's, trying to understand how this can come into play across their lifespan, or maybe for people in their life who are at different lifespans, like how do kind of people come to see you, or like how does this care
Mm.
kind of evolve through, like, my life, say, for example?
Sure. So great question. So I would say adolescence, um, late adolescence, menstruation on, it's the treatment is about learning about your body. So it's a little bit of
Mhm,
sex ed, it's anatomy ed. It's also getting comfortable with the dialogue about the body and being able
mhm.
to advocate in an educated way about what's going on, being able to articulate it in a way that makes sense to you and will make sense to the provider. Number one. Number two, being able to communicate with yourself and with your partner when it comes, and this is throughout the lifespan, about what feels good in your body. I do a lot of sexual health education, and sex is a lot more than just penetrative sex, and that
Mhm.
could be revelatory for a lot of people.
Right. Yeah.
And there's the it takes at least one person to engage. One can engage with oneself, one can engage with another person, but we need to start changing. I often tell my folks, it's like we need to start changing how we talk about this, how we talk about our bodies, because our brain remembers. If it remembers, oh, I really hate wearing green, but I have to for work, and then I feel like shit later and I don't feel good in my body. Are you really going to be able to be present for yourself and for your partner if you have one? Probably not. Your brain's going to not be happy. So oftentimes I am helping facilitate the exploration of expression, of authenticity, and exploring oneself. And I say early on, it's throughout the lifespan, but I love it when
Yeah.
I have someone who comes in early and we can just like, oh, good, let's just do this
Mhm.
now before you go into the world, because that's a scary
All
place.
right. Yes.
Yeah. And then, when it comes to people that are pregnant, postpartum, when I have someone who is pregnant, I do a lot of education just about the changes that happen hormonally within the cycle of pregnancy, what to
Mm,
expect in the body. And I actually set people up in the beginning with not only an exercise plan, but a plan for detection, meaning, ooh, my hip feels a little off today. Oh, that's interesting. Was it at like week 13? Oh, relaxed and super high. Okay, what are we going to do to reset? This is my like late first trimester plan.
mhm,
It looks a little different than my second trimester plan, which I'm building stability, learning how to
mhm.
coordinate pelvic floor in different directions. And then third trimester, more labor prep, getting fitted, believe it or not, for lymphatic garments, because a lot of swelling
Mm,
can happen during pregnancy and people don't talk about that. There's
yeah.
preeclampsia that needs to be, if that
Right.
happens, that is medically intervened on, but a lot of people experience swelling and are just told to deal with it. But there's a lot of
Mhm.
things that can make one comfortable, and mitigate those symptoms. And then postpartum, I go over a very rudimentary just discussion about the importance of different amino acids and protein. I refer to an RD as it relates to wound healing and tissue regeneration, and then a ramp up plan with movement. I also see a lot of people who have had cancer,
Mm.
and a lot of the cancer drugs will actually create and throw people into menopause
Oh,
immediately.
okay.
Yeah.
Mhm.
And so, I got a lot of clients who bleeding, 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 get chemo on tamoxifen. Maybe they have a uterus
Uh,
removed. Boom. Then the body's like, oh crap, like where's
yeah.
the hormones? What are we
Right.
doing? So I'll see, these folks will come in with onset of urinary problems. And that's usually
Mhm.
due to a tissue change. If they've had a
Mhm.
mastectomy, the scars in the abdominal wall, in the chest wall, and those aren't being addressed, because I'm very passionate about this. When it comes to cancer, it's very much survive. And then the community in cancer is about thrive. And it's
Mm-hmm.
changing slowly, but pelvic health gets left out of it because when we think breast cancer, we often don't think about the pelvis.
Yeah.
Right. But we know that the pelvic floor coordinates with the other trunk muscles. And so
Mm-hmm.
any insult above or below is going to affect the thing in the middle, which is the pelvic floor. When
Mm-hmm.
it comes to menopause, perimenopause, menopause, and beyond, I often coordinate with RDs, naturopaths, gynecologists, because when people go through those hormonal changes, their body, yeah, the ability to lay down tissue changes, so strengthening changes, your needs nutritionally change in order to achieve those goals. That's why I have a dietitian I refer to. And then the tissue changes at the pelvic floor because of the dip in estrogen. And that
Right.
can also result in more UTIs. The pelvic floor has become, I'm sorry, the vagina has become a more basic environment, letting bacteria thrive. People don't know that though. They're like, I'm
Mm-hmm.
on azo forever. I have UTIs all the time. And it's like,
Right.
well, wait a minute. Are we using topical estrogen? Why not? And then with that, dispelling a lot of the belief that topical estrogen puts one at risk for breast cancer. No,
Yeah,
no. That study, 2002, the only wreaked havoc on our healthcare system. The
it did.
only thing that study did was increase women's mortality because they weren't going through hormone replacement therapy, because bone density changed, because they had more falls.
Mm-hmm.
Topical estrogen is not the same, so I have a little soapbox, as HRT. Now, for some people, it is not appropriate. If one has had ovarian cancer, I get it. But in the breast cancer world, it's in conversation now that it may be even protective
Mm.
because it's not systemic estrogen. But oncologists, you know, they don't, and people don't want to get cancer again. And I
Right.
get it. I totally get it. But I like
Yeah.
people to have up-to-date information and know
Yeah.
their options. Like, if you don't
Mm-hmm.
want that, maybe we go for more the hyaluronic acid. That's cool. That's
Mm-hmm.
fine. But we need to know. We need to know. We need to know the
Yeah.
most up-to-date information to make an educated decision about what's best for our bodies and
Mm-hmm.
involve and educate other healthcare professionals. I tell patients all the time, I'm like, they aren't this godlike person who can't learn. You can teach them
Right.
something. They
Yes.
should be
Right.
learning every day. Every
Yeah.
day they should be learning. So,
Mm-hmm.
mhm.
Yeah. Oh, thanks. Thank you so much for
Yeah,
sharing that.
mhm, yeah,
Okay,
sure.
the last thing I wanted to ask you about is, will you just share with us what you feel like the most rewarding aspect of your work is?
Yeah. Mhm. Yeah. The most rewarding aspect of my job is when people don't need me, when they don't need me, when they can show up for themselves. And that can mean anything. It can mean they show up at dance class. It can mean they talk to their partner. It can mean they wear the clothes that make them feel good. It's about people living for themselves unabashedly and without shame. I am very passionate about just giving, I always tell people, giving people the tools to feel their best emotionally as well as physically. So we always talk about it here when someone comes in and they're glowy, they're just like sparkly and they're just happy. They're effervescent, right? They're not bogged down with the pain. They're not bogged down with past trauma, that they have healed and gone through hard things to a point where they can get up in the morning and they're happy to get up in the morning, right?
Mm-hmm.
So I I could name very specific things that I'm very proud of, like all my clients for even just coming here. But I
Mm-hmm.
think that's the best thing, is feeling empowered and showing up for yourself. And also, this is this going, okay, not giving, I think I can say this on YouTube, like not giving a
Right.
like what anybody says
Right.
about you, your body, and just feeling comfortable in that.
Yeah.
Mhm.
No. Yeah. I love that. Thank you so
Yeah.
much for
Yeah.
sharing
Of
that.
course. Of
All right.
course.
Well, as we wrap up, is there anything else you'd like to leave us with before we sign off?
Yeah. So, I think everybody is doing, I don't like to say doing their best. but you're doing what you need to do in the moment. If you don't feel like you are, then seek help from people in your community that can assist you, can coach you through it. It's not about doing your best. Sometimes it's just about, eating breakfast in the morning, going to sleep at night, making it through the day. That's it.
Mhm.
So don't put so much pressure on yourself. There will always be more pressure. That's just how our society is built. And
Yes.
know that there's help out there. People like Lauren, people like me, that are here to support you and provide you with resources. Mhm.
Great. Well, thank you so much, Ashley. It's
Of
been amazing talking
course.
to you today.
Thank you. Thank you for talking to me, Lauren.